But
Hello, everyone. Thank you for joining us again today. My name is Dr. Ndidiamaka Obadan, also known as Dr. Didi. I'm the CEO and founder of Younger Self MD Medical Clinic Health and Wellness, located in Kennesaw, Georgia. We help adults at risk prevent and treat medical conditions like diabetes, high blood pressure, and chronic kidney disease in as little as 90 days so that they can go on to live happier, and longer lives. And today I have the amazing Dr. Sarah Merritt. Thank you for
hello.
joining me, Dr. Merritt. Could you introduce yourself to our audience here, please?
Absolutely. My name is Sarah Merritt. I'm a physician anesthesiologist, and I'm also board certified in pain medicine and addiction medicine.
That is amazing.
Yeah.
And she is the CEO and founder of a huge pain medicine practice. Tell us some more about it.
Yeah, so my practice is called Lifestream Health Center. We are located in Bowie, Maryland, which is in Prince George's County. The practice has been around for 15 years or so. I actually purchased it from another anesthesiologist who had practiced in the area for many years. And he was in poor health and actually passed, but so the practice was not at its current size. But it has been in operation for some years, and we have, my first day was January 1st of 2014, probably, and then I bought the practice in 2016, and I have patients in the practice that I've seen since January of 2014 at this point now in 2023. So we're coming up on, some of these people I've known for 8 or 9 years that are my chronic pain patients.
That's amazing. And she's
Yeah.
been growing it and taking care of
Yeah.
all these patients and giving them all this great outcome. So one thing I like to ask my guests on the show is to kind of tell us a little bit about what you do, why you do what you
Mhm.
do, how
Sure.
you got here,
Yeah.
and why pain medicine? I mean, why pain and addiction medicine?
Yeah. Yeah. So I actually got interested in pain medicine because I had a mentor who was a pain doctor. Um, I had a mentor who was a pain doctor, and she, as I came into the program, we were paired up. And so I was paired up with this woman. Her name was Pamela Vick, and Dr. Vick was like, "You don't yet know it yet, but you want to be a pain doctor." I was like, okay, I'm just believing this
She was
woman.
reading your mind.
He's reading my mind. Yeah. I'm like, okay. But really, in terms of the longevity of a career, I think I matched in anesthesia, and the idea around like taking late call and overnights and all of this that was going to be needed to be like at a partnership level in a practice. I had concerns with how sustainable that would be over decades. And so what I saw
Yeah.
in pain medicine was an opportunity to, the hours part certainly was appealing, but what really got me was in the OR, you really have no longitudinal relationships, right? So you put people to sleep and then you like never see them again. And maybe if you're
Yeah.
really thorough, you call them afterward or you follow up the next day, but you don't even know like what happens to these people. And like, did I really train all this time to like have so little involvement in people's outcomes? And not
Yeah.
that OR anesthesia isn't super important, and at its best we do have systems for following up and seeing that, but on an individual basis for the individual doctor it's hard to follow those cases because that's not your role. um,
Yeah.
and so what I really enjoyed about pain medicine was kind of that getting to know your patients, helping people progress over time, and seeing improvement and impact um, over time with patients. And when you've
Right.
helped a patient who has significant chronic pain, very often you've helped them with their worst problem.
Oh, yes. I mean, pain is debilitating, is one of the chronic medical conditions.
Yes.
It's terrible. I mean, being able to alleviate their pain improves their
Yes,
quality of life significantly.
that's right. That's right.
Yeah, yeah, yeah.
For sure. Yeah, so it's really a great opportunity to have an important impact in the lives of our patients. And then I got interested in addiction medicine, really because like once you treat patients with pain, you know, sometimes we write controlled substance medications to help with pain. And so we also have people that may develop a problem taking controlled substance medications, or people who, you know, are taking more than prescribed. And then how do you parse that out? You know, what is pain? What is addiction? Where, you know, is there some line, or is there some gray
Yeah, it's got like an
area?
overlap.
Yeah,
Yeah,
trying
yeah.
to come to understand that. So I got interested in those questions, and you know, just really saw an opportunity, because around the time that I acquired the practice, there really weren't doctors in my local area at that time, in like 2016, that were prescribing like Suboxone or buprenorphine for addiction, and not that many that were certainly doing it under insurance. And so what there was at that time was, you know, if you had an opioid problem, you were going to pay cash to go see a doctor. And, you know, even if your insurance should cover this treatment. And that just didn't seem right to me, you know, from a justice point of view, I guess. And really, like, how messed up is that for society? You know, are we incentivizing people to like think about selling their medicine, right? Like as a doctor,
Right.
do I want to be part of that? Like, absolutely not. You know, and so I got interested in being able to provide that service, and we started kind of a service line in our practice treating patients for opioid use disorder around that time.
That's amazing. That is so impactful.
My
Oh.
dog is growling. She has a tennis ball under the chair, so sorry about that.
Oh, I thought I was hearing some oh,
Yeah, if you
really?
hear interesting noises, that's what it is.
What kind of dog is it? What kind
I
of
have a
dog do you
German
have?
Shepherd.
Oh, I love German Shepherds. I
Yeah,
love big dogs. Like, I just don't
he's
understand the
great.
idea of people who have dogs going with the really small, like, I mean, yeah, do you? Like, I feel like if you want to, if I was to get a pet, I would get a big dog.
She's great. She's great.
But yeah, let me
Yeah,
go
sorry
back
about
to
that.
our
Yeah. Hi, here she
yeah,
is.
yeah,
All
but
right,
oh, like, can we see her? Let's see how
sure.
cute she
She
is.
just came over. That's
Oh,
Inga.
yes. Hi, what's her name? Or his
Inga.
name? Inger. Hey, Inger.
She's like, get my ball.
Sorry, we're taking your mama away for you for a couple of minutes, okay? While we do this very important podcast about opioid use disorders and
That's
addiction
right.
medicine,
That's right.
because this is very important in this day and age. And,
Yeah.
what you were talking about justice is really relevant, with the
Yeah.
disparities. Are
Yeah,
you seeing
absolutely.
any of that, the health disparities in the ethnicities and the races?
Yeah, for sure. I mean, I think I see just a lot of impact, I guess, of, you know, social determinants of health. I think that's the other kind of hot buzzword, right? And so,
Right.
you know, certainly in society, you know, there are people who are disadvantaged because of their race or education, et cetera. And then it sets up a stream of things potentially with health outcomes, right? That
Yeah.
with lower levels of education, people you know, certainly is one. Socioeconomic status, you know, those are particular risk factors. But then
Right.
separate from that, yeah, certainly there are, you know, differences sometimes in terms of race that we have a harder time, you know, getting our hands around.
But now that the insurance is covering a lot, so I was going back to what you said earlier
Yeah,
about initially when it was purely just cash based. So now that the insurance is covering a lot of
yeah,
all this stuff, and I think they've even made some recent changes and made some more physicians able to prescribe this new medication, right?
yes,
So it
yes,
makes
yeah.
it more
PAs and nurse
accessible.
practitioners, yeah,
Right,
can
right,
prescribe, and it is more accessible.
right.
I'm located in Maryland. You know, Maryland has a good Medicaid expansion, right? Not every state used Medicaid expansion dollars from the federal government out of the Affordable Care Act. And in Maryland, we have good Medicaid expansion, and we pay pretty well for Medicaid services, actually, which I think is not normal. Like, not every state does that. And so it's
Mm-hmm.
actually it's good for patients, because certainly Maryland has its share of opioid problems.
Yeah.
Baltimore historically has had a heroin problem, even when the rest of the U.S. did not. But Maryland, does do, I would say, a pretty good job of trying to support support services for people with substance use disorders for medical treatment.
That's amazing. Oh, that's good. Well, thanks for sharing that. So for my audience, I typically like to ask my guests to share 3 practical tips
Yeah.
or action steps to take. What are the 3 steps that you would recommend for
Yeah.
people with?
Yes.
Yes.
So for people with chronic pain, I think the typical action steps that I would think about would be, what can they do to better their own health? I would think about, of course, seeing their healthcare doctor, seeing their provider, consulting a healthcare professional to identify the source of the pain, right? So
Right.
if somebody has a chronic painful condition, do they have a clear diagnosis of what it is? I think that's where, that's kind of where treatment starts, is understanding the problem. And really your physician's in the best position to know that.
Yeah. I mean, for me as a nephrologist, many of my patients there's a noise. Did you hear that? Oh, I think, is it the dog?
Oh, I just muted it. Sorry.
Oh, okay. Many of my patients have chronic pain from, the ones who are already on dialysis, or if they have some skin conditions like calciphylaxis,
Mhm.
or, many of them have like end stage um, peripheral vascular disease, or they may have like calcifications from their bone disease
Mhm.
causing bone pains. Do you get
Yeah,
to come across some of these patients in your
for
clinic?
sure. For sure. For sure. Yeah. And so we have a variety of patients who have pain, and sometimes it's unclear, what exactly the cause is also, right?
Yeah.
Sometimes we're not sure. But then that's hopefully part of the workup, right? If a patient comes to see me, sometimes they may already have a diagnosis where they know, like, oh, I have osteoarthritis of my hip, or
Right.
something like that. They may already know, or it may be unclear. So we're speaking about, my long-term patients in the practice. Some of these folks, if they are doing well, they don't come and see me, but then they show up every now and then when they have a setback, for instance. So I saw a woman this week who's 85 years old, and she has had intermittent injections for back pain. She's had a medial branch block recently for axial low back pain. That's a particular injection that's been really helpful for her in the past. But as she was here, we had to kind of re-examine her and relook at the situation and make sure, well, is this what we think is going on, or is it your hip? Because she's also had some significant hip arthritis. So
Oh,
um,
okay.
for us, that's kind of how that has showed up lately, in terms of finding that right diagnosis, is just needing
Right.
to re-examine patients and even just kind of keeping an open mind. But I think you're right that, there are these many manifestations of other, I guess, systemic diseases, right? Like if you mention calcium deposits and things like that, where some of your renal patients, or patients with significant other systemic illnesses may have pain-related manifestations as well.
Yeah. So the first step, the first practical tip, which I think, as you said, is very important, definitely get involved with your doctors. Don't just stay home and start self-diagnosing and
Right.
self-medicating.
Yeah. Yeah. Yeah.
Yes,
Not a good plan.
that's a very not
Not
a
a good,
good plan at all.
not a good plan. That's right. That's right. Yeah. And in fact, I saw a referral this week, interestingly, of a nephrology patient
Oh,
who had some significant hip osteoarthritis. And she was saying she had actually gotten my name from someone at her dialysis center, that,
oh,
as they start, as you go regularly, right, that you might have a relationship with people that work there or other patients that you see. And that was kind of how she had came across my name. And she this was a patient with hip osteoarthritis. And so we were working together on a plan to deal with her hip pain.
Yeah, that's amazing.
Yeah.
Well, thank you. And so they get to see the physician. And
Yeah.
do you have like so what's the next step? What's the other tip? Like what are some of the, I know that this is something a lot of my audience would like to know, non, medical ways to manage pain,
Yeah.
natural
That's right.
ways.
Well, I was going to say number two is,
Yeah.
I would actually say is engage in physical activity,
Hmm.
which I think is counterintuitive or doesn't sound
Yes,
good to
it
most
is
people would think.
counterintuitive because, hey, I'm in pain. I
Right.
am in
Right.
pain. All I want to do is just sit down and
I
lay
shouldn't do
there.
anything. That's right.
Yeah,
Right.
yeah.
And so, it's hard, it's hard to, um, help patients understand this, that, and I talk about it, I guess, in a variety of ways, and it may depend on the patient, what like ultimately kind of resonates with them. But the body is sort of a use it or lose it type of thing. And so there's that aspect that I think people understand, that bodies in
Yeah.
motion tend to stay in motion. And so
Hmm.
being as active as possible, whatever that looks like for you. And I'll tend to like use a little contrasting when speaking with patients, like, hey, we're not expecting you to run a marathon, but even just that daily walk to the mailbox, could you do that a couple of times?
Yeah.
Doing some easy stretches in a chair,
Mm.
taking a walk with the dog if that's within your abilities. And it depends on the patient for sure, like what is realistic. I'm a big
Right.
fan of physical therapy, and so um I will write patients for physical therapy, as long as they're getting improvements, and that may be a long time, especially if they have a long way to go. It may
Mm.
require a good bit of therapy to get them moving more.
Right. Right.
um So I think, being as active as possible, whatever that looks like for the individual. Oh, and I know what I was going to say in terms of physical therapy. In addition, for some patients, if land-based physical therapy is too stressful or too much for their joints, some patients with significant adiposity, it may be really hard to move and walk very far. Sometimes water-based PT or aquatic physical therapy can be really good.
I'm a big fan. I'm a big
Yeah.
fan of Aqua Zumba, by the
Oh,
way.
that sounds fun.
Oh, you've never heard of it? Oh
Never
my
heard of it. That's
goodness.
great.
Like I personally have indulged in Aqua Zumba.
Oh,
It
that
is
sounds fun.
amazing. Yes, you're in the pool, you're swimming
Yeah.
and you're dancing and doing all
Uh-huh.
the
A lot of
jumping, and
movement.
it's
Yeah.
a lot of movement to the beat, to the
Hmm.
really
Hmm.
nice
Hmm.
music. And if you have a great instructor, as I did, um a couple of years ago after I had my third child and really wanted to lose weight,
Yeah.
that was it was fun. It was fun and I moved a lot, and
Hmm.
there were a lot of people who had chronic pain that were in the pool with me at the same
Yeah.
time, and they found it really easy because of the it's weight bear it's
Weightless. Hmm.
weightless, exactly. So
Yeah.
whatever pain you're having in your joint, the water
Yes.
kind of makes you float on it, and then you're able
Yeah.
to move. And so, yeah, I was waiting for you to just say that because I have personally
You've
experienced that, and
experienced.
it is amazing. Aqua
Yeah.
Zumba,
Yeah. It
yeah.
really is. Yeah. And I think it can be part of a progression for people. And so, initially starting in the water, um, moving those joints, getting better range of motion, being able to, walk in the water, etc. And then that can turn into, doing more on land over some time. Um, and I would say, I have a patient that I can think of who has a significant spine fusion through, like, most of her cervical and thoracic spine is just fused. And
Oh,
she maintains a healthy weight. But her exercise is she goes to the pool and she just walks. And it's,
mm,
she calls it water walking, and she finds it, and she's not overweight, but she finds that it's just much gentler on her joints, on her
It's
body,
easier.
be able to
Right,
do that.
right.
Yeah, and it's
So
been
is that because of the weight of the things that they used to fuse her spines or what?
yeah, it's a good question. I think and it may also depend even on the pool that you're in. Very often some of those pools that are designed for aquatic therapy or aqua classes, they may be a little bit warmed also. And so while they
Mm,
are cooler than your body temperature, they're warm,
yeah,
that they're soothing in some way.
yeah,
There's
yeah.
that, just like a temperature effect that's generally pleasant. And then I think, yeah, just less stress on the joints overall. And yeah, the spine, of course, is part of that. And
That's
less
amazing. How about some foods? Are there some foods that can help with pain management? So what kind of, I
yeah,
know
absolutely.
non-inflammatory diet for sure, but
Yes.
are there any specific kind of, do you know of any diet that has a lot of like analgesic properties? I read somewhere one time or so that peppers have
Hmm.
some elements, but I don't know if it's something that you generally prescribe to your
Right.
patients.
Yeah, like capsaicin maybe is the
Yes,
ingredient in
exactly.
peppers. Yeah.
Capsaicin. Right, right, right.
Yeah, I haven't prescribed that. I mean, and certainly topically, there's good data for capsaicin topically. So for patients with neuropathy, particularly diabetic peripheral neuropathy, but other types too, to use capsaicin, the dilute that's available at the pharmacy, is like 0.25%, or excuse me,
Hmm.
0.025%. So pretty gentle. And that can help with nerve pain. It's actually a little uncomfortable initially to apply. But then once the treatments occur, it can become more tolerable over time. And then it often can reverse some of the pain of neuropathy.
But we shouldn't advise our patients to go and start loading up on all the peppers.
Right.
No, don't do that, right? No.
And do that. I think really just an anti-inflammatory diet is what we'll hear talked about for better pain management, and for that probably has individual properties that might be different for different people, but certainly
Right.
something that's maybe closely resembling the Mediterranean diet and not resembling the standard American diet. Right. And I eat standard American diet stuff from time to time, but I think it's really
Once in
just,
a while, it's okay. Yeah, no
yeah,
judging, no judging.
I think it's really a matter of really trying to be conscious, of one's eating each meal of the day. And, if patients have some weight to lose, then the diet discussion can also be part of that. Um, but yeah, I think incorporating healthy fats like olive oil, avocado oil, some of these things to cooking, et cetera, that these healthy fats are better for myelin, which is the nerve covering of the brain and the nerves. So supporting
Right.
those things with these healthy fats and not with like, trans fats or the ones that are generated from frying foods. Um,
Hmm.
there are some people that will feel better with a diet that's lower in dairy. So for some people, dairy causes inflammation, and that's been associated with pain in some studies. So there are some studies that one of my mentors did in rats back in the day, and looking at rats that had got a soy diet versus rats that got a whey-based casein diet. And you give the same rats the same nerve injury, and the dairy rats do worse.
Mm.
And so, again, I don't know that, you know, that's totally applicable to humans necessarily, but that in addition to, anecdotal evidence that, there are some patients that have had benefit from cutting out dairy. I think that can be inflammatory for some people.
Hmm.
And really, dairy is delicious, but not really necessary. In our diets, it's not an essential food.
Especially after a certain age, a lot of people become lactose intolerant as we grow
That's right.
older.
That's right.
Right.
Yeah.
So, mhm.
And I think, we kind of love our cheese on things, but really, it's an addition of like fat and calories. It's not adding a lot of nutritional value. And so maybe instead of also like what not to eat, if we can also focus on maybe what to eat, you know, and focusing on vegetables, meats that are lean, and more vegetables and some fruit.
Yes, 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 yes.
You know, and
Okay.
Michael Pollan is famous for having said, you know, eat food, mostly plants, not too much. And I think that encapsulates a lot of things also. So mostly plants, if you're leaning heavy on that. I also have some patients that have done well eliminating gluten from their diet. I don't think that's necessary for everyone, but I do have quite a number of patients either with, we've maybe as a medical professional, you are familiar, of course, with celiac disease, but then there's also this thing called non-celiac gluten sensitivity. And there are a lot of, a fair number of people, maybe more than we've realized in the past, that have some of this type of problem where they may have just inflammation or discomfort related to ingestion of gluten, and cutting it out can make a difference in terms of pain.
When they say you are what you eat, they
Yeah.
weren't joking, you know? Yeah.
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 It's true. It's true. Yeah. So I think, you know, we've had kind of a reductionist view of calories that, you know, oh, well, you just need, you know, these many calories to fuel your body. But I think really shifting that and thinking of food as fuel and what do you want to fuel with? And we should focus on vegetables and, you know, lean, healthy protein sources.
Keep a healthy diet, people. This is helpful, even for pain.
Yeah, it is.
Okay.
It is.
Yeah. And is that our third tip, or we were kind of talking about the natural, you know,
Yeah.
non-medicinal, so the natural ways. And
Yeah.
I think that was the
I
second
think
tip.
being active is maybe deserves its own point, and
Yeah, and
maybe
then
other stuff might
all
be the
the other
third point. Yeah, other stuff, including, yeah, diet. Because I think diet's big enough to be its own point.
diets is big. It's really big. Like
Yeah.
everything that we just talked about, you know, we could. So do you often send your patients to go to dietitians to like get their whole meal plans figured out and stuff
You
like
know,
that?
I probably should. I do not do that super regularly. I do have a PA in my practice who likes to do some dietary counseling. So she's not a dietitian, but she
Mm-hmm.
certification from the Institute for Functional Medicine. And she's done
Oh,
some
okay.
elimination diet work. And so I actually did it myself, just so I would know like, what this was that we were offering to patients, and did like this 6-week elimination diet of eliminating gluten and dairy and all kinds of things. And
Really? Did you
haven't
notice any
I haven't gone
changes?
back. I mean, I would say I eat some gluten, I eat some dairy, but I no longer think of myself as just like, oh, I eat everything, which is kind of how I
Mm,
used to think of myself. And now I kind of have modified my habits, and I feel better. And at the
mm.
time I was just having, you know, personally, I was just having some like bloating sensation, and I was looking to address that, and then to make sure I understood the program that we had. And it did
Right.
help.
That's amazing. Oh,
Yeah.
well, thank you for sharing that with us. So, the last part that we're approaching the last segment of our podcast, which is like share something interesting that happened to you recently or something that made you feel empowered.
Ooh, something that happened to me or made me feel empowered. My goodness.
Yeah, something interesting. It doesn't have to have make you feel like, you know, if you're not into the whole empowerment, feminism, but
Yeah.
you know, people tend to want to hear something uplifting
Yeah.
or something
Something
interesting.
uplifting. No,
I could,
I'm just like super fortunate, honestly. I feel I was just thinking about some of our, you know, challenges on the one hand, and, you know, in the business, and but no, I'm really just super fortunate, and to have a great team in my office, and to have a great family. And I'm just, you know, I'm just super blessed. And I think that, you know, I want to work hard to help the community, and help other people to live their best lives.
oh, that's so sweet.
Yeah.
Well, I hope you will come back for another episode with us in the future. This was really good. This was really amazing. And how can our audience find you? I know you're in Maryland, I'm in Georgia, but if people were around the
Yeah,
Maryland area and wanted to work with you, how can
please.
people find you?
Yeah, so we're at lifestreamhealthcenter.com is our website. You can send us a message from there. We're also on Facebook, facebook.com/lifestreamhealthcenter. And we're on Instagram as LifestreamHC. And yeah, I would love to connect with people there. Our YouTube channel actually too is Livestream Health Center, and we have a series of live broadcasts. And so check out the YouTube channel, and under those live headings, we've got a lot of different education on different topics as health topics as they intersect with pain.
This has been amazing. And you can find me at youngerselfmd.com. And we're currently accepting patients. Our phone number is 404-566-4623. Thank you so much for joining us. And stay tuned for the next episode and our mystery guest. Find out who our mystery guest is going to be. Thank you so much, Dr. Sarah. This was so good.
Glad to be here.
Thank
Thank you.
you.